Hello, everyone. We are so happy that you can join us today for our webinar, Harnessing Innovation, How MAKLab is Accelerating Progress for Health Services. My name is Megan Ivankovich, and I'm the Senior Learning Director for the USAID-funded Momentum Knowledge Accelerator with Population Reference Bureau, or PRB. Next slide, please. Next slide, please. So before we begin, I want to go over just a few logistics. This webinar is available in both English or French. So to view the French version of the presentation, go to the top middle of the screen where it says View Options. Select the option that says Diapo en français, and I apologize, I do not speak French. Next slide, please. To hear interpretation, look at the bottom of your Zoom screen and locate the globe icon that says Interpretation. Click the language you would like to hear. To hear the interpreted language only, click Mute Original Audio. If you are on a mobile device, in your meeting controls, tap the three dots and then tap Language Interpretation. Tap the language you want to hear. To hear the interpreted language only, tap the toggle to Mute Original and click Done. Next slide, please. So if you haven't done so already, please introduce yourself in the chat. This webinar will be recorded. We'll be posting the recording to the Momentum YouTube channel and we'll share it along with the presentation with all participants. Throughout the webinar, you can put your questions in the Q&A function in Zoom. Please do not add questions to the chat. You'll be able to see everyone's questions in the Q&A function and even upvote or like other people's questions that you want answered. We'll do our best to address all questions by the end of the webinar, either by responding in the chat or addressing key questions during our panel discussion. And finally, please keep your microphone on mute and your camera turned off to reduce background noise and preserve bandwidth during the presentations. Next slide, please. And now for the fun stuff. Today's webinar is hosted by the Momentum Knowledge Accelerator. Momentum Knowledge Accelerator is part of the Momentum flagship suite of integrated projects aimed at accelerating improvements in maternal, newborn, and child health, nutrition and voluntary family planning, and reproductive health. Momentum Knowledge Accelerator serves as the connector across the suite of projects by building systems and creating tools for sharing data and information to advance learning and better achieve momentum objectives. Next slide, please. Today, we're excited to share more about one of the services Momentum Knowledge Accelerator offers, Momentum. The Measurement, Adaptive Learning, and Knowledge Management Lab, or MAKLab, offers specialized on-demand technical support to the Momentum projects. Considered Momentum's innovation lab, MAKLab is a unique mechanism designed to identify and spread promising solutions to complex challenges that enhance and sustain access to quality, equitable health services across the globe. During this webinar, you'll gain an in-depth understanding of how MAKLab operates and learn about 3 product solutions that have emerged from MAKLab that might be relevant to your work. Our expert speakers will provide an overview of why and how these resources were created and share real-world examples of how they've been effectively used in various contexts. Next slide, please. We have an exciting panel of speakers that includes Adam Lindsley from Momentum Knowledge Accelerator, Elon Ebling and Emily Grappa from Momentum Routine Immunization Transformation and Equity, and Farhad Khan from Momentum Safe Surgery and Family Planning and Obstetrics. I am delighted to introduce our first speaker and my colleague on Momentum Knowledge Accelerator, Adam Lindsley. Adam is a senior project manager at Ariadne Labs, where he supports a portfolio of globally focused research and implementation projects across the primary healthcare and better birth teams. In this role, he manages Ariadne's portfolio of activities across the Momentum Knowledge Accelerator project, which includes Primary Impact and MAKLab. Adam also worked at the Clinton Health Access Initiative on projects throughout sub-Saharan Africa, ranging from health workforce, nutrition, and infectious diseases. He holds an MPH from Tulane, where he focused his studies on global health and development, and a Bachelor's of Science from DePaul University. So Adam, I'm going to pass it over to you.
Thanks so much for that introduction, Meg. Next slide. So I know that Many of you might already be familiar with MAKLab, uh, but for those that aren't, I'm going to give a very quick overview. Next slide. So what is MAKLab, you might be wondering? Well, as Meg said, we're Momentum's virtual learning laboratory. We accelerate the development and spread of emerging solutions across the suite of awards. More specifically, MAKLab works with Momentum Awards to spread promising solutions to persistent, shared, or complex challenges by leveraging expertise in measurement, adaptive learning, and knowledge management. The solutions that we strive to produce are practical, innovative changes to a strategy, a tool, a measure, or an approach that will improve service delivery outcomes or measurement. Next slide. Now, there are a variety of approaches that MAKLab can take depending on the need of the award. Over the course of this webinar, we'll discuss a few activities that included elements of each of these bolded actions on the left of this slide. One thing I want to highlight here is that I've seen awards benefit from bringing in this outside perspective that MAKLab brings, but also we're familiar enough with the overall landscape and we're able to dedicate time to really dig into the issue at hand, crack it open, and explore what a solution might look like. Next slide. So you might be wondering how MAKLab operates. Most of the time, we receive direct requests from the Momentum Award. Some of you may have corresponded with my colleague, Jossie Fifield, our senior technical specialist who leads MAKLab. Jossie's out on parental leave right now for a couple more months, so I'm filling in during her absence. But once we receive that request, we then triage activities based on expertise available and overlap with other MK or momentum-wide work. We really start digging into the work with a period of co-designing the activity, choosing a method of technical support that might be most appropriate, and assembling a cross-award activity team. For instance, in the past, we've pulled in clinical experts, as well as adaptive learning, digital health, and M&E expertise as needed into activities. Once we've executed the activity, and then lastly, there is an element of learning and spread that whether it's a new implementation model or a relevant desk review, we work to amplify it. And that's exactly what we're doing here today, as a matter of fact. Next slide. So here's how that whole process plays out throughout those steps. I know this process may seem like a lot, but it usually goes fairly quickly between the steps, with the longest one being execution. Generally, our activities are short-term in duration, so that typically means around 12 weeks. We also have an option to do what we call an accelerated response activity. This mechanism is meant to replicate a full MAKLab activity, but on a much smaller scale. So it has fewer individuals involved in eligibility assessment and less required documentation. And that's in order to meet a more rapid timeline. The duration of these accelerated responses are usually around 4 weeks. Next slide. Now, as I mentioned, MAKLab expertise includes measurement, adaptive learning, knowledge management, and even implementation. We have a fair amount of experience across these technical support areas, so we're able to mobilize quickly and really delve into the work. An example would be a recent activity we completed with Momentum Country and Global Leadership. who wanted to understand the interaction between faith-based organizations and the delivery of primary healthcare in low-resource countries. We conducted a lit review to provide background information and a framework for further work that Momentum Country and Global Leadership Faith Engagement Team was conducting on primary healthcare. Next slide. This slide summarizes all of the activities we have done to date. Before we transition into some of the featured resources, I want to give a few details on what we do and we don't do. We must first ask ourselves if we can do the work. Do we have the technical capacity to provide a high quality product? And do we have the staff capacity to take on the activity at any given time? Also, the request must align with Momentum goals. We also consider whether something duplicates effort. If another team, award, or staff person is working on the same or a similar activity, or if it's in an awards work plan, then it doesn't meet our eligibility criteria. But we're here to help Momentum Awards with determining eligible requests or thinking through what support you might need. You just need to contact us with your needs or challenges, and we can have a discussion whether they would be a good fit for MAKLab. The last thing I will note is that the services provided by the MAKLab and MKA team, including MKA staff time, they're offered at no cost to the awards. So don't let cost be a barrier. Next slide. So let's get into some of the featured resources. Next slide. The first resource we're going to discuss today is called the Documenting Adaptive Learning Toolkit. Next slide. Now, adaptive learning is not a new concept. It's certainly a popular buzzword now, but we're really seeing a lot of confusion around how to do it and do it well. During a monitoring, evaluation, innovation, and learning working group webinar that was facilitated by our former MAKLab lead, Erin McCarville, in July of 2023, participants from a few Momentum Awards highlighted examples of how they have implemented adaptive learning in their programs. But discussion, several panelists identified documentation of and communication about adaptive learning as a consistent challenge, in part due to the need for more standardized tools for documenting adaptive learning. So in this instance, MAKLab engaged these panelists after the webinar to learn more about their experiences and to see if an activity might be useful. In November of 2023, we began by designing and deploying a survey to understand the experience of award teams with documenting adaptive learning. In tandem, we completed a desk review during which we identified 31 templates or guidance documents for documenting quality improvement actions and activities related to adaptive learning. Next slide. We then analyzed survey and desk review results and followed up with some key informant interviews to identify key users and needs for documenting adaptive learning, with the aim of identifying high utility tools to support documentation. We found that documentation tools are often scattered, lengthy, and not located in a single space. And we produced a toolkit that addresses this challenge by design as an appendix that users can quickly access to utilize products that are relevant or of interest to them. All identified templates were converted into an editable format and collated into this toolkit. So we're now going to hear from Ilan Ebeling. Ilan is a monitoring, evaluation, and learning advisor on the Momentum Routine Immunization Transformation and Equity Project. That's USAID's flagship technical assistance mechanism for immunization. Ilan has expertise conducting mixed methods research across topics in international development and global health. She enjoys working across teams to measure program impact and implement continuous adaptive learning practices. She holds a Master of Public Administration degree from the University of Washington, Evans School of Public Policy and Governance. Over to you, Ilan.
Great. Thanks so much, Adam, for that introduction. If we could go to the next slide, please. And next slide. Great. So I'll be sharing an example today of applying adaptive learning on the Momentum Routine Immunization Transformation and Equity Project in the Eastern Europe region. And before I dive into more of the specifics around our adaptive learning approaches, I wanted to start off with some overall context about the project. So, although COVID-19 vaccines were introduced to the Eastern Europe region in 2020, vaccination rates were still really lagging 2 years later, with less than half of the population in our focus countries of Moldova, North Macedonia, and Serbia having received the full course of the vaccine. So it was in that context that USAID's E&E Bureau tasked the project with increasing vaccine uptake in the region. And the project focused on two key populations, which we identified as being not only particularly vulnerable to COVID, but also particularly vaccine hesitant. So the first of these was pregnant women, and the second was adults 45 years of age and older living with a chronic disease. These populations had a number of misconceptions about vaccine safety and had also received mixed messages from their medical providers, who themselves were also uncertain about the vaccine safety for these groups. So as a result, the project designed two interventions to address key behaviors for these populations. So the first was a continuing medical education training for medical professionals, including doctors, nurses, and pharmacists. And these were designed to increase provider knowledge about the COVID-19 vaccine safety for the key populations, and also to encourage them to recommend their patients that fall into those groups to get the vaccine. The second intervention was a series of collective engagement events designed and implemented in partnership with local NGOs to engage pregnant women and older adults with chronic diseases and encourage them to get the full course of the vaccine. These workshops were small group discussions and exercises that involved playing games and other interactive activities to learn about the importance of getting the vaccine. Next slide, please. So as we began implementing these activities in our three focus countries, we pretty immediately started facing some challenges in terms of being able to rapidly capture and synthesize learnings. And this was due in large part to the pace of implementation of the project. So over the course of about 9 months, we held 65 CME trainings and 265 collective engagement events, many times, implementing more than one event in one day and operating in a complex and rapidly changing environment. So rather on, kind of focusing on implementing full-scale rigorous evaluations, we really wanted to focus on how to continuously improve both the intervention design and process throughout implementation, but it was quite difficult to systematically capture these learnings from all the many facilitators who are implementing these activities across the three countries. So what we did as a project was to adapt an after action review template to a Google Sheet note-taking tool, one for the continuing medical education events and one for the collective engagement events. And we asked facilitators to fill these out after every event. So as you can see by the table at the bottom, this tool kind of, incorporated all of the standard questions that you would ask in an after action review. So things like what went well, what didn't go well, etc. And we sensitized this tool with our NGO partners who then held sessions with facilitators to discuss with them the importance of filling out this tool and the importance of their input and reflections in being able to ultimately contribute to the effectiveness of our work and what we were trying to achieve as a project. And this adaptation in a spreadsheet format worked really well for our project because it allowed facilitators to quickly share their notes and reflections, which was really key given the number of responsibilities they had and the number of events that were taking place. And furthermore, the Google Sheet format allowed for real-time data collection that central staff could then immediately use to analyze what was happening in these activities. So a really great example of how different kind of standard adaptive learning resources can also be adapted to fit different specific project contexts and needs. Next slide, please. And then finally, this note-taking tool, along with other quantitative and qualitative project data, was really key in guiding our project's ongoing adaptive learning processes. So this slide gives an overview of how our project implemented adaptive learning processes overall. So starting from the left with the implementation of our project interventions, the CME and CE activities, and then moving to the right, we gathered a variety of data from those activities, including project monitoring data, CME evaluations, a limited number of interviews with event participants, and then of course the data from the note-taking tool was really key. And so all of these outputs of that rapid data collection was then synthesized and used to inform regular team-wide data review meetings, as well as learning exchanges with CME trainers and CE facilitators. So through these sessions, we really tried to emphasize team problem solving, both within countries, but also across countries. And as a result, we came up with a number of strategy adaptations that then fed back into our program implementation. So there are a few examples listed on this slide of some of the more significant program adaptations. And so, for example, in Moldova, we really heard that it was critical to include influenza and measles vaccines. So we updated the CME training to include these. And then in Serbia, we really heard from the collective engagement participants that including their family and friends was really critical to their decision making in deciding whether to get the COVID-19 vaccines. So we adapted those events to include family members and friends and partners of pregnant women and people with chronic diseases. And then finally, we shortened the CME course from its original length and provided a comprehensive FAQ document to help kind of smooth implementation of the CME course. So some of these adaptations happened, very quickly on the spot. Others happened within weeks, but it was really an iterative and continuous process where we had these adaptive learning mechanisms in place to be able to collect the real-time data, analyze it as a team, and then use it for action to improve project processes and implementation overall. Back to you, Adam.
Thanks so much for that insight, Ilan. For those in the audience, can you think of any ways to use this toolkit in your own work? If yes, put a 1 in the chat and tell us your idea, and we'll see some of the adaptations that might be helpful. All right, so the next activity we're going to discuss is called factors associated with uptake of immunization toolkits and guidance. Next slide. Now, many immunization-related resources are created to address critical technical components of activities, but oftentimes these resources are not designed to provide information for the end user to facilitate adoption and implementation of the resource in practice. So as a result, gaps commonly exist between the information in a resource and what is needed to ensure its proper implementation. As a work plan activity last year, the Momentum Routine Immunization Transformation and Equity Project was examining immunization-related toolkits such as the WHO's zero-dose child toolkit to understand opportunities to improve their uptake and use. To support this work, they requested assistance from MAKLab to identify evidence-based factors, things like barriers, facilitators, and contextual elements that should be considered when evaluating implementation of existing resources or identifying a resource for use or even developing new resources. MAKLab conducted this activity by first doing a desk review of gray and published literature related to the uptake and use of toolkits and guidance in low and middle income countries. We categorized the evidence gathered from the desk review into 5 constructs based on the Consolidated Framework for Implementation Research, or CFIR. Next, MAKLab interviewed key informants to ask about their experience implementing immunization-related resources to understand the factors that facilitated or limited implementation for them. Next slide. MAKLab produced what we thought were an easy-to-read set of tables that summarize the findings from both the desk review and the key informant interviews. We organized those findings into 2 tables. The first was what to consider when choosing a resource, and the second was what to consider when implementing that resource. To talk about their use of this work, we have Emily Grappa. Emily is the Monitoring, Evaluation, Learning Director for Momentum Routine Immunization, Transformation, and Equity. Emily has worked in public health for more than 15 years at the intersection of health systems, data, and analytics in digital health. She enjoys using mixed methods approaches, tackling complex evaluations, and promoting data-driven action. Over to you, Emily.
Great. Thanks, Adam. Hi, everyone. If we move on to the next slide. And again to the next. Thank you. So as part of our project, the Momentum Routine Immunization, Transformation, and Equity, as Adam mentioned, we work on a number of toolkits. So sometimes supporting the use of existing toolkits, sometimes developing our own toolkits. So that's why we reached out to MAKLab to come up with this resource about the factors that can help support the uptake of toolkits. So one of those toolkits that we have worked on is the Urban Immunization Toolkit that you see on the slide here. This toolkit was developed by the Urban Immunization Working Group in 2018 and is primarily intended for district-level immunization managers as a supplementary resource to help tailor immunization strategies specifically for an urban context. It's organized based on the WHO Reaching Every District strategy, and it's intended to be really complementary to that guidance that many folks on the call may be familiar with. And it was developed primarily based on a desk review and some high-level inputs. Next slide, please. So the challenge was that the actual use of this urban immunization toolkit was unknown. So our project partnered with the Urban Immunization Working Group on two objectives that you see here. First, to document lessons learned from using the toolkit, and to apply a human-centered design lens to understand users' needs and map out use cases for the toolkit. We did this through two phases. So the first was global interviews to document experiences with using or not using the toolkit. And then the second phase was country level co-creation workshops. These were held in Nigeria, really to identify pathways for addressing the needs of urban health immunization stakeholders using this toolkit as a key resource. And the intended outputs of this work were recommendations for improving the toolkit and developing or revising one or two modules of the toolkit based on the results. Next slide, please. So the MAKLab resource that Adam introduced on facts associated with uptake of immunization tools and guidance outlines 4 key considerations for designing or selecting a resource. So those are the 4 you see on the slide here: effectiveness, adaptable to local input, value added or relative value, and ease of use. And so we used the MAKLab resource and these 4 domains as a conceptual framework for our activities, research questions, and to inform our data collection tools and our analysis approach. Next slide, please. So to give you a really specific example, as part of our research, we developed a survey to understand how immunization.
Emily?
Oh,
Yeah, I
sorry.
think you're on mute.
Sorry, Adam. It looks like it got muted. I'll restart on this slide. So as part of our research, we developed a survey to understand immunization stakeholders' perceptions and experiences in using and adapting the Urban Immunization Toolkit. So the survey questions that we developed were informed by the MAKLab framework with statements related to each of those framework domains. So you can see those on the slide here. And these formed the survey questions. So participants rated their level of agreement with each statement on a 1 to 5 Likert scale. There were also some open-ended questions for respondents to reflect on their experiences with the toolkit. So in the first phase, we had 23 respondents to the survey who were development partners and government staff from 8 countries. And in the second phase, we had 44 respondents who were co-creation workshop participants from the 2 local government areas in Nigeria. So we analyzed this survey data along with additional in-depth qualitative data collection that we did in Nigeria. So that included some key informant interviews, focus group discussions, and co-creation workshops, and synthesized all this data to develop some key recommendations. If we go to the next slide. So this is really a snapshot of our 6 top-line recommendations to improve the content, uptake, and use of the Urban Immunization Toolkit. So we again used those MAKLab domains to organize our recommendations. So you can see recommendations 1 through 4 are directly related to those 4 factors that influence uptake. And then in addition, through our research, we identified 2 additional factors that influence the uptake of resources like toolkits. So that includes iteration, really maintaining the toolkit as an up-to-date living document, and accessibility, making the toolkit accessible to broader audiences. For example, through developing it in additional languages, it's available in English and French, and socializing it more widely. And I just want to call out the recommendation number 3 around value add. So specifically on this one, we heard that it would be really valuable to add more topics specific to urban settings, such as reaching migrants, engaging private sector, utilizing social media and digital tools, and implementing in conflict-affected urban areas. And so all these recommendations have been shared with the Urban Immunization Working Group, and they were very receptive to them and are currently thinking through the next steps to implement these recommendations to improve the toolkit. And as an immediate next step, our project is taking forward this recommendation number 3 to add new modules, and we're currently developing a module specifically on private sector engagement. Thanks. Back to you, Adam.
Thanks, Emily. For those in the audience, can you think of any ways to use this toolkit in your own work? So if yes, put a 2 in the chat and then tell us your ideas. All right, so the last resource we are going to talk about today is a blended learning toolkit. Next slide. Blended learning is the process of combining 2 different educational methods, so like face-to-face and remote learning into one course. COVID-19 coupled with increased global access to internet and technology has certainly accelerated the growth in blended training models. Momentum Safe Surgery in family planning and obstetrics wanted to develop blended learning systems for a family planning training to support their efforts to improve equity, quality, and coverage in family planning services. So Momentum Safe Surgery in family planning and obstetrics requested support from MAKLab in the midst of the pandemic to ensure adherence to best practices in adapting an existing family planning curricula for health workers to a blended format with a digital self-directed component. As we do with many of our activities, we conducted a landscape analysis to provide examples from existing resources and guidance from experts to support the tender process for contracting a digital health partner to achieve their goals. Next slide. The MAKLab team produced 2 interrelated products. The first was a list of best practices for adapting family planning training materials to a blended learning format. And the second was an annotated list of existing digital and blended family planning training materials. So incorporated into each best practice were tips, considerations, and resources on how to execute that. Now, to talk about their use of this work, we have Farhad Khan. Farhad supports monitoring, evaluation, research, and learning functions on momentum safe surgery in family planning and obstetrics. In this capacity, he has designed and implemented country program co-creation activities, advises on the design and conduct of research activities, coordinates the global project's learning agenda, and supports the implementation of the project's performance measurement framework. In past experiences, he has led a variety of evaluation, assessment, and adaptive management efforts for large-scale USAID-funded health projects. Farhad holds a master's degree in international health from the Johns Hopkins School of Public Health. Over to you, Farhad.
Thank you, Adam. It's a pleasure to be with all of you. So, as you all know, conventional approaches to clinical training involve some sort of didactic learning, practice, cascading, and follow-up supportive supervision and mentoring. Health workers often need to pause service delivery in order to receive training. And as you all recall, the pandemic prevented health workers from receiving training in this conventional way. And so one of the lessons emerging from the pandemic was that countries needed to strengthen health systems so that they could be more resilient to shocks and stressors. And one way to support this is by delivering clinical training through digital blended modalities. The idea is to deliver as much of the didactic content through videos as possible, minimize the time that health workers spend away from service delivery, and then maximize in-person time on practice. Momentum Safe Surgery wanted to digitalize one of Engender Health's existing family planning training packages for this purpose. The trainings that we looked at converting were already blended. They had slides and manuals covering the didactic parts as well as the in-person practical part. In fact, some of the training packages we looked at were already digital in some way. The slides and handbooks were all already online, for example, which was the case for the training resource package. However, the hope was that having a training package delivered through like a computer or smartphone with videos and interactive forms of teaching could bolster the remote part of learning. And that's what I mean by digital. What was nice was that the Momentum Knowledge Accelerator project had developed a very thorough distance and blended learning guide. We used a lot of information from that. However, we felt that we needed more information on two fronts. First, we wanted to know what to do if we wanted to convert an already existing training curriculum into the digital format. Second, we wanted to know what digital curricula already existed out there to ensure whatever we intended on developing wasn't redundant to what was already out there. And so we asked MAKLab for technical support across both of those fronts. Next slide, please. We filled out an intake request with the MAKLab team. They told us that they were able to support us on this work, and then we had exchanges to determine what the resource would look like. MAKLab developed an activity plan, which we reviewed, and more importantly, they engaged digital health experts within the Momentum Knowledge Accelerator project to advise on this work. And with all that, we settled on a landscape analysis, which included a spreadsheet of all digital learning packages out there, as well as best practices. The spreadsheet of digital family planning courses included the name of the course, organization offering the course, learning modality, objectives, competencies, target audience, technology requirements, continuing medical education, credit eligibility, and effectiveness data were available. And the landscape review expanded on what was already in Momentum's distance and blended learning guides, going deeper into describing three specific best practices. One, clarifying training goals and process. Two, maximizing access. And three, maximizing learning and engagement. Next slide, please. The idea was to issue a solicitation with the landscape analysis attached that any digital vendors responding to the RFP would incorporate the MAKLab defined best practices into their proposal. The twist in this was that the best practice guidance eventually led us to not continue with the activity. So when we were designing the RFP, we consulted with our country teams to ask if they're interested in piloting the training. Several declined for various reasons. In two countries, limited connectivity and project-supported geographies was a major challenge in using this type of approach and was therefore not desired. In one of our project implementation countries, our colleagues had told us that health workers were quite fatigued from virtual and Zoom trainings and had preferred in-person trainings instead. And so, although the best practice, according to this resource that MAKLab developed, was to design with the user in mind, it would have been really difficult to do this under the circumstances that we were dealing with. Moreover, learning management systems need to be maintained. The best practice guidance walked us through different types of learning management systems and what to consider when developing such a system. It became clear that there would be a high upfront cost and high recurring costs with the development of a digital training package. Who assumes those recurring costs after a project ends is a really pressing question. And so this process and MAKLab's resources and recommendations were invaluable to us in coming to the decision to not go further with this particular effort, which would not have met a user-defined need, nor would have been able to be developed to the standard we would want. And so despite the best practice guidance not translating into the development of a digital training package, it was a pleasure to work with MAKLab. I think the challenge for us to specifically parameterize what we were looking for, and so they were able to propose ways forward when presented to us made a lot of sense. And so with that, I'm going to close my remarks. Thank you so much.
I want to give a huge thank you to each of our speakers. It's so exciting to hear about how these MAKLab resources have impacted your work, as well as the communities in which we work. So before I dive into our panel discussion, I want to invite our audience to reflect on the blended learning technical brief that Adam and Farhad described. Can you think of ways to use the blended learning technical brief in your own work? If yes, please put a 3 in the chat and also share any ideas on how you think you can use this resource. And so as those responses are coming in, I welcome all of our panelists to come off or turn on your camera and join us for our panel discussion. So I do have a few questions for our panelists, but I also, as we're talking, encourage the audience to keep adding any questions that you may have within the Zoom Q&A function if you have any questions about MAKLab or the resources that we highlighted today. So as noted, all of the tools that we featured here today are available on the Momentum website. So to our audience members, have you seen or used MAKLab tools before? We welcome any volunteers to comment on those tools in the chat or to come off mute to share those experiences if you have used the MAKLab tools or other resources that we've made available. So colleagues, again, a huge thank you. It's been really illuminating to hear how MAKLab has supported the different Momentum Awards and really how these MAKLab resources have taken on a new life and really served a range of different purposes. So I have a couple of questions for you. And again, we'll wait to hear if any questions come in from our audience. But my first question is going to be for Adam. And so just curious, what value do you think an entity like MAKLab plays in a collaborative environment like Momentum?
Thanks, Meg. I think that there are a couple of things. The first is that when I imagine everyone working on their own project, we're oftentimes so in the weeds, focusing on the day-to-day, that it can be difficult to take that step back and devote time to really understanding what some pressing challenges are. I think a real value add that MAKLab brings is we're able to work with the awards at no cost to them and provide that bandwidth to delve into what the research is saying on a particular topic or speak with experts and then compile and synthesize all that information into something that is actually going to be useful across the suite of awards. The second area is that MAKLab works under the umbrella of Momentum Knowledge Accelerator, which is designed to be the connector across all of the awards. So we're oftentimes aware of common challenges across different projects, and we can draw out learnings that might be applicable to others. Thanks.
I love that, Adam. Thank you so much. And of course, other panelists also welcome your thoughts on this question if there's any additional comments or thoughts you have about MAKLab's contribution to our collaborative environment, but no pressure. Elon.
Thanks. Yeah, I just wanted to add that I think it's part of what's so valuable about it as well is just that MAKLab has visibility into a whole suite of awards, and so being able to identify those common challenges and themes that are arising across projects in order to really effectively create resources and facilitate the sharing of knowledge across so many different projects is such a huge value. So just wanted to add that.
Thank you so much, Elon. My next question is for all panelists, so feel free to come off mute as desired. But one of the purposes of this webinar is to really share the tools that MAKLab's developed that might be relevant for our global audience members. Do you have any recommendations for how others could use the tool that you highlighted today in different circumstances or contexts?
I'm happy to start with this one. So I talked about the tool, the factors associated with uptake and use of immunization toolkits and guidance. I talked about this in the context of a specific immunization toolkit, But I just wanted to note that I think that this resource can definitely be applied to other types of resources, not just toolkits. It's definitely valuable for thinking about uptake and use of guidance documents, policy briefs, anything that you're really trying to get in the hands of end users to use. And I also talked about, the factors that we considered in assessing this urban immunization toolkit. But the MAKLab resource, has factors to consider when designing or choosing a resource. Those were the four kind of overarching domains I shared. But the guide also includes several factors to consider when implementing a resource. So things like training, user buy-in, effective messaging, etc. So just to say that was one piece of the tool, but there's a lot of great content in there. And I don't think, it specifically was a landscape related to immunization, but I think a lot of these factors for consideration would apply to other health areas beyond immunization. Thanks.
Thank you so much, Emily.
I'm happy to go next. So if you're considering developing some form of digitalized training, whether it's clinical or not, I would just consider reading the distance and blended learning guides. I think there's several principles and practices that are worth thinking through. And whenever we develop any type of tool, the point of it is to be used and sustained. And I really do think the guide has several principles and best practices that encourage that. On a practical matter, if you're considering partnering with an organization that focuses on digital training curricula development, the guides can give you some parameters to define that partnership. And that's kind of what we were trying to do when crafting our RFP. From our own experience and kind of going through this process, I think one key lesson that I learned is that it shouldn't be pushed from the top down. I think donors should really be responding to country stakeholders' needs, like, the Ministry of Health or professional associations, such as like National Obstetrics and Gynecology orders, and we're kind of developing training curriculums in response to their needs. And also, like, I think it's a little unstated, but I think it should be said that it could be a huge effort to digitalize training. And I really do think that the distance and blended learning guides does a good job at breaking that down. Thank you.
Thank you so much, Farhad. And, we will certainly be sharing the links to the resources that we highlighted today, but we can also add the other links to the other blended learning toolkits that Momentum Knowledge Accelerator had developed earlier in the project. So thanks for those flags. I think it's a really useful compendium of resources. Great. Any other comments about how these tools could be used in different circumstances or contexts? And if not, I know we only have a few minutes left, so I definitely have two questions, but also curious from our panelists, what are some of the general principles or best practices that can be drawn from the tool that you highlighted today?
I'm happy to start this one off. I think there are a few things that come to mind for me that made the use of this kind of adapted after action review turned note-taking tool so successful for our particular project. So the first one is that we really adapted it to our specific implementation context. So really getting feedback about, okay, how can we make this as accessible and easy as possible to use for the folks who are actually implementing project activities, while also allowing us to receive the real-time data that we were hoping for. So that was one. And then we also put a lot of effort into socializing the tool's use among project staff and really talking with them about the importance of their reflections on the success of our work, and talking about how the data would be used to really kind of get that buy-in from the folks who would be using the tool. And this really helped to ensure that uptake of the tool was happening, so that it wasn't just a nice spreadsheet that we made that then just didn't get used. And then finally, we also didn't use the note-taking tool in isolation, right? But really made sure that we were actually using the data that we were getting. So taking the time to synthesize it and then feeding it into other adaptive learning approaches like data review meetings to really bring folks across the project together to be able to come up with some actionable items as a result.
on those are such helpful insights. Thank you. I know we only have a couple minutes left. Any other comments about that, about my previous question, or can I jump into my last question for Adam, which is a rapid question in our last minute? But what do you think is the most valuable thing that MAKLab can offer Momentum and the global community in the final 2 years of Momentum?
Well, I think that MAKLab has demonstrated it's possible to embed a flexible and creative innovation hub inside Momentum, and it provides support and guidance to all 6 awards. So that's been really cool to see. But innovation is not only about creating new things, it's about repackaging and spreading interventions that are effective. It's about taking lessons learned from implementation and translating them into translating them with new information and experiences. So I think MAKLab with is drawing on its experience in measurement, adaptive learning, and knowledge management innovation, has the opportunity in the last 2 years to support projects as they continue to disseminate that work through abstract, peer-reviewed publications, conference prep, to learn from their experience, and that could take the form of measurement consolidation, lessons learned for monitoring and evaluation, and making the products from some of MAKLab's previous activities relevant beyond the Momentum suite. So I think that those are all areas that we could pursue over the coming year.
Thank you so much, Adam. And I know we don't have much time to discuss, but always welcome other feedback on that question from our other Momentum Awards in terms of how MAKLab can best support you during the final 2 years of implementation. There's never enough time for these conversations, but I want to thank each of our panelists for their contributions to this webinar. Thank you for how much you've taught me, even in the last hour. And really thank you to our audience for joining us to learn more about MAKLab. We really request each of you to please take a moment and just tell us what you thought about today's webinar by completing the evaluation. My colleague Deb is posting the link to the evaluation in the chat right now. And finally, we will be sharing all event materials by posting them to the Momentum website and sending them out to all of you who registered for this event today. So with that, thank you, and I wish you a fantastic rest of your day.
Thank you. Thanks, everyone.
Thanks, everyone.
Thank you.